The coronavirus pandemic has exposed the deficiencies in the health system, and as community transmission of coronavirus spikes, governments are looking to change strategies by moving into communities to ramp up testing. But most primary health systems, considered the first line of defense, are in a deplorable state due to years of neglect. Joining me via Skype is Dr. Tunji Funsho, a physician, cardiologist and chairman, National Polioplus Committee of Rotary International. Thank you for joining us in TVC Breakfast.
Thank you very much for having me. Good morning.
Yes, before we go into the role primary health care plays in times like this, talk to us your assessment of the primary health care situation, the state of the primary health care in Nigeria, because a lot of persons when they talk about this, it comes with a lot of mixed reactions.
Well, we all are quite familiar with the very deplorable state of primary health care in this country. I would like to situate it from some of the concerns that have been appreciated for a long time. The Alma Ata Declaration in Kazakhstan in 1978 put this on the front burner, and this was African ministers of health met and accepted that, primary health care is very important. As a matter of fact, the declaration that health is a human right was re-endorsed. But since then, we've had quite, a lot of other opportunities for African, heads of states and also their ministers of state to reevaluate and recommit themselves, to this effort. The Bamako Initiative in 1987 was one of them. And the most recent one, in 2001, the Abuja Declaration, which actually now gave committed, governments to spending about 15% of the health budget on health, was one of those. Those have always been met in default. So as it is now, we have a very huge dent in the level of primary health care facilities in this country. Out of 30,000, that was the initial plan. Some structures were built. The last, we know is that just barely 20% of those primary healthcare centers are functional. So the situation is very, very poor and abysmal indeed.
Some would say that as far as some countries have been able to meet up with the 2001 Abuja Declaration that you pointed out, but for some African countries, some challenges like a large death burden, shrinking foreign assistance, and inadequate resources have hindered their meeting up with the declaration that was signed in Abuja. What really is our own challenge when you look at it critically?
I believe, it's ensuring that, we put to practice what we agree and put on paper. I do not want to believe, I'm talking about Nigeria specifically, I do not want to believe that Nigeria does not have the resources to provide basic health care for its people at the primary care level. Indeed, that is the cheapest way to run a health care, because most of the illnesses, almost 75% of the illnesses, that cost a lot of money in the healthcare sector, when they are allowed to fester and get to the secondary or tertiary level, can be minimized and aborted at the primary healthcare level. So it is much more cost effective to have an efficient primary healthcare system, than to wait for people to get very ill, end up in secondary care institutions that will require admissions or surgeries and the like, before we start, expending huge amounts of resources on it. Unfortunately, in Nigeria, those resources actually come from out-of-pocket expenses when it gets to that stage. So individuals have to scurry here and there, from relations, from the employers, to find resources to be able to manage their healthcare, which is not salutary in our environment. I think we need to have a policy that ensures we keep to a declaration that has assured every person in this country of basic good primary health care, because it's a fundamental human right that has been enshrined by the UN, and we have signed to that.
And for COVID-19, there have been concerns of a community spread, especially in areas where the government may not really be able to penetrate to some areas that are being perhaps described as slums and all of that. But how much difference, if the primary healthcare was as functional, how much difference could that have made at this point?
It will have made a huge lot of difference, because the concept of primary healthcare includes promotive activities, preventive activities, and curative activities. Promotive activities is what will have been helpful for us at this point in time, and then going a little bit to preventive activities. And you see, the concept of primary healthcare actually involves community participation. There are supposed to be community committees that assist in ensuring that there's a buy-in. Because, as I've always said, you cannot shave a man's head in his absence. Primary health care should involve the communities themselves so that they help to sustain it by ensuring that, a demand is created. Created for what? For health promotion, for health prevention, like immunization, like, nutrition, and also preventive, health education to prevent diabetes, obesity, and all forms of other preventive diseases. So it will have been a very useful tool for us if we have those communities that have these committees that work with the primary health care to help to promote this health promotion aspect of primary health care at the community level. And I think this is one of the things going forward we should try and entrench in our primary healthcare system, because 75%, like I said, of our healthcare needs is at that level. And if we take care of it going forward, we'll find that, our healthcare costs will go down. But unfortunately, for various reasons, they tend to be neglected.
So if we are to address this now, where do we begin?
I think we need to dust up, some of the, documents that have been set up, for this purpose. I recall when Professor Likoye Ransom Kuti was the Minister of Health from 1985 to 1992. He made a lot of efforts, to ensure that, primary healthcare services are enshrined. In fact, it was at that time that, the Primary Healthcare Directorate was set up. It was during that time that the Nigerian Primary Healthcare Development Agency also was established. If all those documentation were followed through, and they're there, all we need to do is to dust them up. I recall during the era of Professor Dewale as the Minister of Health, there was the 10,000 health centers initiative to try and revitalize our primary healthcare system. Because it's not just buildings. There's also the human resource aspect. And as we all know, there's a huge disparity between the medical human resource available in the cities as opposed to those available in the rural areas. There isn't enough incentive for people to leave the cities and go to the rural areas. Another initiative was that of nurses and midwives. That the federal government started at one time. I don't know what is happening to that now, to incentivize nurses and midwives to go and serve in primary healthcare centers in rural areas. So that also has been observed in default.
All right, Dr. Tunji Funsho, thank you so much for speaking with us. Well, joining me via Skype is Dr. Tunji Funsho, physician, cardiologist, and chairman, National Polioplus Committee of Rotary International. Thank you for joining us on TVC Breakfast.
Thank you for having me again.
Now, I'd like for you to lend your voice to this line of thoughts by a cross-section of Nigerians that perhaps the administration of primary health care should not be left in the hands of the local government, because they can't necessarily fund the primary health sector as much as the federal government would.
Whilst I agree with that, in the broad sense, that, the federal government should participate. As a matter of fact, in recent years, the local governments have abrogated the responsibility for taking care of their communities at the local level. Most of the interventions in recent times have been by the federal government. But you see, the funding is at two levels. The federal government budget, provides for primary health care. In recent times, there have been dedicated budgets for primary health care that is expended by the Federal Ministry of Health, the primary healthcare development agencies, and the states. The challenge basically, is that there is a disconnect between what is required and what is provided. The health budget has literally remained stagnant, and in some years actually had been reduced. As I mentioned earlier, the Abuja Declaration agreed that as much as possible, 15% of the budget should be allocated to health. Currently, Nigeria is about 4%. Now, with those kind of allocations, and that is assuming that all the budgetary allocations are actually provided. We all know that, more often than not, because of either dwindling resources or other priorities, these amounts of, funds are not actually made available. The states also make budgets for health that are supposed to be expended, for this particular purpose. But again, they're also expended in default. So it's a joint thing. Health is on the concurrent list on the Constitution, but I believe that the people most equipped to deal with issues at the primary healthcare level are the states and local governments. The reason for this is simple. One, they know their terrain. As much as health is universal, there are usually differences in the way that people perceive their health care, differences in the kind of disease patterns. For instance, there's a huge disparity when we talk about, say, maternal mortality. The average for Nigeria is about 800 deaths of women, dying in pregnancy-related, situations of 100,000. Now, that is an average. If you desegregate it, you find some states in the southeast, south-south, and southwest having figures as low as 500, while you have, states in the north having figures as high as, 1,200. So those states will have to place a little more priority on providing for health care, for antenatal care, and also for deliveries than those in the south. So the states and the local governments must do more to situate, the problems of high maternal mortality and high infant mortality at the state level. The federal government, of course, being a much larger government with a much larger share of the resources, should assist the states. But I believe that primary health care should be situated in the hands of the local governments and the state governments.
All right, Dr. Tunji Funsho, thank you so much for speaking with us.